Okay, our next topic is about scatter radiation, filtration, and patient exposure or patient dose. Okay? Okay. It is a major challenge for lab techs, okay, to protect patients from excessive exposure to radiation or to unnecessary exposure to radiation, okay, which may occur as a result of unsafe procedure or inaccurate exposure factors. It can be either uh, as a result of uh, repeat examinations, dahil gumamit ng inappropriate exposure factors, either hilaw, either sunog, okay? Or due to improper instruction or lack of instruction, okay? Pag-develop, may mga metal artifacts, okay? Or dahil sa improper use pa rin ng inappropriate factors, so nagkakaroon ng uh, increased patient exposure, increased scatter radiation. So of course, precautions, okay, should be taken for patient protection. And this includes the use of filters and beam restrictors. Okay? Okay. So ang ating X-ray machines ay meron na siyang inherent filtration. Okay? So filtration. Kailangan may sufficient filtration ang ating X-ray machine system. Okay? So later we will be talking about the filtration, inherent and added filtration. Okay. So in the meantime, scatter radiation can be reduced by restricting the size of the beam, okay, that exposes the patient. So ano ibig sabihin? Kung ano lang yung body part na examine, yun lang yung ating kailangan napatamaan ng radiation. Okay? Then, other factors associated with the production of scatter radiation, alam naman natin, we have the kilovoltage, okay, the part thickness, okay, and tissue density. Ito yung mga kinoconsider natin na factors that affects scatter radiation as we discussed in our previous lessons. And now, filtration. So filtration of the primary beam, okay, it is accomplished by the use of metal devices called filters. Okay, and these filters are placed, okay, sa dinadaanan ng ating primary beam. Okay, what is the primary function of filtration? Okay, so the primary function of filtration is to reduce patient dose. Okay, that is the primary function of filtration, to reduce patient dose. Okay. The secondary function or purpose is to filter, okay, to filter, kaya filtration, okay, low energy photons from the beam. Ibig sabihin, tatanggalin niya yung mga low energy photons, okay, na walang kakayahan to penetrate body parts and reach the IR. Okay? So, sir, paano mo masasabi naman na ang primary function niya is to reduce patient dose? Okay. Kasi po kung wala pong filters, okay, So yung low energy photons, hindi mapipilter out, malamang. Ano mangyayari sa low energy photons? Ma-absorb lang siya ng body part. Okay, ma-absorb siya ng tissues. Okay. So, meaning, the patient dose will be increased. Okay? So, with the use of filter, these low energy photons will be absorbed by the filter. Okay? At dahil doon, hindi na siya ma-absorb ng pasyente or hindi na siya makakarating sa patient. The amount of radiation absorbed by the patient depends on the number of low energy photons absorbed by the filter. Okay, so therefore, the main function of a filter is to reduce patient dose. Okay? So as I mentioned earlier, we have, when we say filtration, okay, we have inherent and added filtration. Okay. So pag pinagsama yung dalawa, ang tawag doon ay total filtration. Okay. So inherent filtration is the amount of filtration provided by the X-ray tube structure, housing, and collimator. So may naka-open and close parenthesis na if attached. Bakit may if attached? Kasi po no, yung mga lumang X-ray machine system, hindi pa po nakakabit yung tinatawag nating collimator. So ngayon sa lahat ng mga bagong X-ray machine system, so connected na po or attached na po ang collimator sa mismong X-ray tube. Okay? Okay. So, kabilang daw sa inherent filtration yung tube structure, housing, and collimator. Okay. Sa housing, meron tayong glass envelope, di ba? We have the glass envelope, which is made of Pyrex. Okay? This glass envelope provides approximately 0.5 millimeter of aluminum equivalent filter. Okay, or filtration. Okay. So the window and port of the tube housing, along with an attached collimator, accounts for approximately 1.0 millimeter of aluminum equivalent inherent filtration. Okay? So yung glass envelope, it provides 0.5 millimeter of aluminum equivalent filtration. So yung window or port ng tube housing, okay, kasama na yung naka-attach na collimator, okay, it provides 1.0 millimeter of aluminum equivalent inherent filtration. Okay, my question is, bakit ang ginagamit na filter ay of aluminum equivalent? Bakit hindi of lead equivalent? Bakit po kaya?
Sir, kasi po mas mataas yung absorption ng lead kaysa sa ano.
And therefore,
Mas mataas din yung absorption ng
ano yun? Laksan mo.
ayun po. Mas mataas nga po yung absorption ng lead, and kapag nabuga, baka po less na lang po yung X-ray photons.
Okay, very good. So, tama. Kasi kapag ginamit mo yung LED, ano ang mangyayari? Halos wala nang X-ray photons na makakarating sa body part at sa film, di ba? Kasi na-absorb na lahat ng filter mo na LED. Okay, so, yun yung reason why we use aluminum. At hindi makapal na aluminum. Certain millimeter lang. Okay. Then we have added filtration. Okay? So, syempre kung the word added, so meaning there is mayroong nilalagay na material. Okay, so added material placed in the pathway of the beam. So ito tinatawag natin na filters. Okay? Filters are placed between the X-ray tube and the beam restrictor device. Ano yung beam restrictor device natin? So we have the collimator. Okay? So ayan yung reason why aluminum. Okay? We may also use copper. Okay? However, mostly ay aluminum ang ginagamit. Okay. Sa isang thesis ng isa sa mga dating estudyante ng department, okay, ang kanyang thesis ay clay. Clay as a substitute filter. Yun. Ginawa niya experiment yun. Okay, then, okay, so yun. So, ano daw ang disadvantage ng copper filter? Is the copper material itself. Why? Because copper produces characteristic radiation in the energy range of 8 kilo-electron volts as the X-ray passes through the filter. So when copper filters are used, they must be used along with aluminum filters because the photons could interact with the copper, producing characteristics radiation that would actually increase the radiation dose of the patient. Siyempre, bakit mag-increase ang radiation dose ng patient? Dahil sa characteristic. Because characteristics radiation or characteristic radiation are low energy X-ray photons. Diba? Kaya nga Bremsstrahlung yung main reason why we have images in our radiographs. Okay? So aluminum filters must be placed nearest to the patient when used in combination with copper. Okay, so sabi dito, aluminum may also produce characteristic radiation. However, the energy level of radiation is so low that it is absorbed in the air gap between the patient and the filter and does not contribute to the patient dose. Okay? So, sobrang hina daw ng possible characteristic radiation na maproproduce ng aluminum. So, mahaharang na siya ng air particles. Okay. So, added filtration ranges from 1 to 3 millimeter aluminum equivalent in thickness. Okay? So, increases in filter thickness will increase attenuation of all energy photons. Okay? Siyempre, in-increase mo nga naman yung kapal ng yung filter, mas mag-increase yung capability niya to absorb energy photons. Okay? An increase in thickness of filter. Okay? Okay, so same. So as the thickness of filter increases, the attenuation of primary beam will increase also. However, the quality of radiation decreases. Kapag daw in-increase mo yung filter thickness, mag-increase yung absorption ng primary beam. Pero, yung quality of radiation decreases. Nag-gets niyo ba kung paano?
Yes po, sir.
O, kasi nga, di ba, kapag tinasan mo yung filter, o yung thickness ng filter, tumataas din yung pwede niyang ma-filter out na energy photons. Okay, let's say, yung particular thickness ng filter, let's say, ang kapal niya is 0.5 millimeter. Ang kaya niyang salain is hanggang, let's say, 30 kilo electron volt, halimbawa. Okay, pag in-increase mo siya, mag-increase din yung masasala. So therefore, mababawasan din yung quantity ng radiation. So kapag nabawasan yung quantity, ano ba yung mga nabawas? So, oo nga, nabawasan ng low energy, pero at the same time, nabawasan din uh, ng radiation na may kakayahan na mag-penetrate sa body part. And so, affected yung quality of radiation. Okay? So, increased thickness of filter over NCRP recommendation only serves to absorb or attenuate more of high energy photons and decrease the number of primary beam. So unfortunately, no material exists that filter only low energy photons without attenuation of high energy photons. Okay. So, kung mapapansin nyo, ginamit yung two terms. Diba? Una ginamit absorption, tapos attenuation. So remember na ang isang meaning ng attenuation is partial absorption. So kung yung high energy photons, kay dumaan siya sa filter na makapal, syempre tatagos yun. However, pagtagos niya, ano mangyayari doon sa X-ray photon? Mababawasan na siya ng energy. Magiging, let's say, para medium energy or low energy photon na lang din siya. Okay? So again, when you combine inherent and added filtration, it is the total filtration. Okay? So ito yung total filtration, okay, na kinakailangan ng ating X-ray imaging system as recommended by the NCRP. Ito ay US agency yung NCRP or the National Commission for Radiological Protection. Okay, so kilovoltage, sa yung total filtration na kinakailangan. Okay. Dahil ang ating mga X-ray machine ay above 70 kilovoltage, so the total filtration of our X-ray machines is 2.5 millimeter aluminum equivalent. Okay? So yan yung total amount of filtration. Okay? So filtration of 2.5 millimeter aluminum equivalent may decrease skin dose by as much as 50%. So ganun ka significant yung filtration. Okay, particularly 2.5 millimeter equivalent filtration. Okay? So it must be clear that filters protect the patient from excessive exposure to radiation. Okay? So exposure factors. So, yan. Filters attenuate all energy levels. Sabi na nga natin kanina. Okay? So when using filters and increasing thickness, okay, will require a slight increase in the exposure factors to maintain adequate density levels of the film. Siyempre, kung gumamit ka ng filtration or ng filter, added filtration, okay, kailangan mag-increase ng technical factors to maintain the density and contrast sa film. Okay. For mammography units, okay, so usually ang mammography units naman is especially designed siya. So meron siyang ibang way o iba yung kanyang filtration. Okay. So breast tissues has low subject contrast and special equipment required for high quality images. Okay. So, karamihan ng mga mammography unit ay minimum filtration lang ang ginagamit. Okay. Because, bakit? Kasi mababa lang naman yung kBP na ginagamit nila. It ranges 30 kBP. Okay. That is required to produce the maximum contrast of the tissue. Okay. 30 kBP, ilan ang total filtration? 0.5 ba? 1 ba? Or 2.5 millimeter aluminum equivalent? Okay, so
0.5.
0.5. Okay. So ang inherent filtration ng mammography unit is approximately 0.1 millimeter aluminum. Okay. So in comparison with the normal or general radiography X-ray machine, mas manipis yung glass window ng mammography unit. Okay. Kaya nga ang kanyang inherent filtration lang ay approximately 0.1 millimeter aluminum. Okay. So bakit reduce ang uh, total filtration, okay, ng mammography? Okay. It is in order to maximize subject contrast. Yun yung reason kung bakit reduce, pinababa yung total filtration. Or kung bakit kailangan na hindi mataas yung total filtration. And now we go to the compensating filters. Okay. So filters are added to accommodate variation in tissue thickness. Okay, these are called compensating filters. So most common type of compensating filters, yung tinatawag na wedge filter. Okay. So the wedge filter would be used to examine for examinations of the femur, the thoracic spine, okay, and angiography of the lower extremities. Okay, so thickest part would be placed under the thin side of the filter. Okay, and of course, yung thinnest part naman ilalagay mo sa uh, thick side ng filter. Eh dahil sa filter na yan, the radiograph will have uniform density. So that is an example of compensating filter. So yan ay nilalagay sa ating X-ray tube. Okay. So yan yung compensating filter. Okay? So ang collimator, okay, with collimator, this, nandito yung ating beam restrictor. Okay? Nandito ating beam restrictor sa loob nito. Ito yung control natin for the beam restrictor or collimator. Then, ito yung ating filter. Compensating filter. So, kinakabit lang siya sa X-ray tube. Okay? Ito yung mga different types of filter. Wedge filter. Okay? Yung makapal na part, nasa thin part ng filter. Okay? Yung manipis na part, nasa thick part ng wedge filter. Okay? So, scatter radiation must be controlled to produce quality radiograph. Okay? Bakit? Kasi para maiwasan yung fog. Okay? And to avoid a reduction of visibility of details. Okay? Para maiwasan din yung decrease of contrast. So yan yung mga reason why we must control scatter radiation. At the same time, para mabawasan ang patient dose at to prevent, okay, hazard to radiation health workers. So it is important to understand that scatter may account for as much as 50% of the exposure to the film for a chest radiograph, as much as 90 to 95% for abdominal X-ray. Okay. So scatter contributes to the overall densities, but it decreases film quality significantly. Okay, why? Because it decreases film contrast and visibility of recorded detail. Okay. Factors affecting scatter, so we have KB, kilovoltage, the field size, and part thickness, or thickness of the part to be examined. So kilovoltage, if we increase kilovoltage, it will increase the effects of Compton interaction. Okay. And therefore, it will increase scatter radiation. Okay? So with increase in KBP, the probability increases with any interaction that occurs, okay, that it will be Compton interaction. Okay. So magkakaroon, pag nag-increase tayo ng KBP, yung X-ray interaction with matter, yung probability niya ay tataas na lahat ng interaction ay Compton interaction. Thus, sa Compton interaction magkakaroon ng scatter radiation. Okay. Kaya nga meron tayong choice sa mga technical factors. Okay. So, ito yung mga effect ng kilovoltage. Okay. do the kilovoltage, kapag in-increase natin ang kilovoltage, okay, the amount of scatter reaching the film increases. Okay. However, the radiation dose absorbed by the patient decreases. Yun nga lang, mag-decrease nga ang radiation dose na absorb ng pasyente. Okay? Tataas naman ang, o pwede naman tumaas ang exposure ng mga health, radiation health workers due to the scatter radiation from the patient. Okay. So, ano yung mga possible na gawin para maiwasan yung pagkakaroon ng PAD? Okay? O para mabawasan yung scatter radiation. Ito ay paggamit na tinatawag na grid. So grid are used or is used to improve the quality of the film by absorbing a portion of the scatter radiation before it reaches the film. Okay. So yun yung grid. So grid, ano ba itsura ng grid? Para siyang board, pero pag tinanggal mo yung surface, makikita mo yung mga lines sa loob. Yung mga strips. Okay? At yun yung nag-filter out ng scatter. Okay, of course, field size, pag nilakihan mo yung field size, okay, or yung area na kung saan tama ang radiation, okay, mas malaki rin yung, okay, yung scatter radiation dun sa area. Okay. So, pag nilitan mo yung field size or yung collimated size, collimated area, lilit din yung scatter radiation. Okay? So, it is as easy as that. Okay. Thickness of part and scatter. Okay. Mas maraming na-absorb. Mas mapal ang tissue density. Mas maraming ma-absorb na X-ray photons sa low energy. And therefore, it can produce scatter radiation. Okay, so pag manipis ang body part, okay, so mas konti lang yung scatter radiation na ma-produce. Okay, so isang way to reduce the tissue thickness ay yung compression bands, okay, na nilalagay para lumiit yung mga tiyan. Okay? Okay. And also, kapag abdominal x-ray, ang ginagawa ng iba ay instead na supine, ang patient position ay pinapadapa nila or prone position para makuna ng radiograph. Okay? So these are the filters. Okay? Compensating filters, the wedge, and other types of filters. Okay, so this is with the use of a wedge filter. Ito ay walang filter. So, dyan pala makikita nyo na yung increased in quality of image. Diba? Mas visible with the use of proper filtration compared sa walang filtration. Okay? Okay. So in the image, you will see yung proper na pagkakasunod-sunod nila. Okay? So the filter is between the X-ray tube and the patient. Okay? Tabletop. After the table, the grid. Okay? And okay, the cassette. Okay? Okay. The grid is placed between the patient and the image receptor. Laging tatanda na ang position ng grid, okay, between the patient and the image receptor. Okay? So, representation of the primary beam and scatter radiation. Okay? So, X-ray tube. Okay, this is what happens when there's a lot of scatter radiation. Mas malaki yung field size, mas maraming scatter, mas maliit yung field size, konti lang yung scatter radiation. Okay, same dito sa image. Okay. So, pinapakita dito, pag walang object, primary penetration lang. Okay. Kapag mayroon ng object or part to be examined, the primary beam, okay, pag dumana yan sa patient, hindi na siya primary beam. It can be scatter radiation or it can be remnant radiation. Okay? So ito scatter radiation, absorb radiation, ito naman remnant radiation. Ito scatter na nakarating sa film, scatter na hindi nakarating sa film, remnant radiation na nakarating sa film yung natirang radiation or attenuated X-ray photons. Okay, so that ends this lesson. Okay, so